Hi folks, I'm Ryan and welcome back to the reading room. This week we're going to be talking about coughing and wheezing in a middle-aged cat. So to begin with, we have a 10-year-old male castrated domestic long-haired cat who's indoor only and lives in Ontario, Canada. This cat is presenting with intermittent coughing and wheezing for approximately 10 weeks. As part of our diagnostic workup, we acquired radiographs. Here we see a dorsoventral and a left lateral projection. So let's take a second and look at what our major findings are. The first thing that's jumping out at me is that there are increased opacities along the airways, and this is what we would consider a bronchial pattern. We can notice that there are numerous regions which form both lines and rings throughout the pulmonary parenchyma. This includes regions in the caudodorsal lung as well as cranially and cranioventrally. The other thing that we're noticing is this linear soft tissue opacity along the margin of the cardiac silhouette, which corresponds with this triangular increase in opacity to the right of the cardiac silhouette in the dorsoventral projection. This finding is consistent with collapse of the right middle lung lobe, a common finding in asthmatic cats. If we look at the next right lateral projection, we don't see that same feature, and this is because of the effect of atelectasis on the down lung. So that right lung lobe is dependent in this right lateral projection, and we're not seeing that alveolar pattern within that right middle lung lobe. But we do still see the bronchial pattern characterized by these increased markings along the patient's airways. So this is a pretty pronounced bronchial pattern in a cat. If we kind of summarize what our findings are, it's primarily that bronchial pattern, but of course then that collapsed right middle lung lobe. And this happens in asthmatic cats due to bronchial plugging and secondary atelectasis of the lobe. When we see this pattern on radiographs, we oftentimes think of asthma as our primary differential diagnosis, but there could be other things going on. It's important to consider infectious etiologies, whether it be heartworm-associated respiratory disease or other infectious causes such as Allerostrongylus, toxoplasmosis, or mycoplasma infections. For next steps in these patients, in some instances it may be indicated to do further workup. That could include fecal Behrman, heartworm tests, or airway washes for cytology and culture, mycoplasma cultures. Oftentimes, when we either can't do additional diagnostics because of the clinical situation, or perhaps it's not necessarily indicated, we might start empirical therapy for asthma, which is typically glucocorticoids and bronchodilators. If you're interested in learning more about treating asthma in the modern veterinary setting, there's a really nice update from 2020 available in Veterinary Clinics of North America, Small Animal Practice, and this does a really nice review of feline asthma, its diagnosis and treatment. So I hope this has been helpful the next time you're seeing a coughing and wheezing cat in the clinic and helping to interpret those radiographs, especially that interesting finding of the collapsed right middle lung lobe.